Welcome to another Ovadia Heart Health telemedicine live stream, and today I'm privileged to be interviewing Dr. Philip Ovadia, the man who started it all and wrote the book Stay Off My Operating Table, also has a podcast by the same name. And today we're going to talk a little bit about what it takes to reverse heart plaque and improve your metabolic health and improve your overall heart health. Before we get started, I'm going to let Dr. Ovadia explain that this is for informational purposes and educational purposes only. Here we go.
Great to be here with you, Chris, and excited to discuss this topic. This is probably one of the more frequent questions that we get asked about. But, any advice that we are giving here is not medical advice, and you do need to check with your healthcare professional. If you might be interested in working with me and my team, for us to be your healthcare professional so that I can give you individual medical advice, you can reach out to us. You can shoot an email to team@ifixhearts.com or go to ifixhearts.com and hit the talk button to set up a call with one of the members of our team.
Well, great. This is a topic that really got a lot of interest after you published an article on the topic a couple of months back. And I mean, it really got a lot of traction on X and on other platforms, including LinkedIn. And so the article title was Reverse Your Plaque, How to Reverse Your Plaque. And it was a long, in-depth article, and I will put the link up on the screen. But just getting started with the big idea, first of all, the answer to the question that everyone wants to know is, can heart plaque really be reversed?
Yeah, so, to jump straight to the answer is yes, it can be reversed. Now, there are a couple of things that we need to understand first to lay the groundwork for this discussion. So we're talking about the plaque that accumulates within the arteries of the heart, what we call atherosclerosis. And this plaque can lead to problems in really one of two ways. So the first thing that can happen that we worry about is what we call a plaque rupture. And what that basically means is that you have some plaque that's building up on the wall of your blood vessel, and it may not be a overly significant amount of plaque that's there, but all of a sudden the plaque starts to separate from the blood vessel wall, and it essentially starts to break off. And this causes a blood clot to form, among other things, other ways that the body reacts. But essentially what we're worried about, blood clot can form and it can block up the blood vessel. And that can lead to a heart attack. So that's problem number one that we worry about. Now, problem number two that we worry about is that the plaque can build up to such a degree that it's actually narrowing the blood vessel and it's choking off the blood supply essentially through that blood vessel. And that's more of a chronic process that happens over time. So that's why we worry about plaque. And then if we're thinking about, well, can plaque be reversed, or how do I know how much plaque you have, right? We need a way to measure the plaque. And there are two primary ways that we do that. The first is what's called a coronary artery calcium scan. And people have probably heard me talk a lot about this. That's a easy, inexpensive test, pretty low radiation dosage, and usually not much cost involved. And the limitation is it only shows us one type of plaque, what we call calcified plaque. It doesn't show us what we call non-calcified, or sometimes people will say soft plaque. And to see that, you need to do what's called a CT angiogram.
1 second, before you go any further, I think from what I've seen and heard, a lot of people never even get that far with their regular doctor. They go in and they're told that they have high LDL cholesterol, and what comes next? Here's a statin or multiple drugs. Can you just explain a little bit about that? Because I think that's like, it seems like so many people don't even get to the CAC scan. So what's going on with the leap to statins as the first line of defense against high LDL cholesterol?
Yeah, this is a great point, Chris, and it's something that's very important for people to understand. And we've had many discussions about what LDL cholesterol may and may not mean when it comes to your heart disease risk. But what's most important for people to understand is LDL cholesterol is not the same thing as plaque, despite what many doctors sort of have that misconception. And your blood cholesterol level, and in fact, any blood test that you get is not going to tell you whether or not you have plaque in your arteries. If you want to know if you have plaque in your arteries, you need to image the arteries. And, the CAC, the CT angiogram, or the most invasive option being a cardiac catheterization are the ways that we can actually image the arteries and see if there is plaque there or not. Very important to separate those two. LDL cholesterol might have something to do with your risk of developing plaque, although, as my audience knows, it's not a great predictor of that. But even if you accept the LDL cholesterol narrative, it does not tell you how much plaque you have in your arteries.
So is it possible that there are a lot of people that are, focused on the wrong metric, and that they are actually, even if they are reducing their cholesterol, they might actually be incurring other negative effects along the way?
Yeah, definitely so, because the primary driver of plaque in the arteries is actually inflammation and insulin resistance, right? And cholesterol is part of the process that leads to the plaque formation, but it's not what starts the process. And damage to the blood vessel wall related to inflammation and insulin resistance is what starts this plaque formation, the process of plaque formation. And that's what we need to focus on if we want to stop the progression of plaque or even consider trying to get reversal of plaque.
So could you, you were in the process of explaining the CAC scan and the CT angiogram. What does the CAC really provide for somebody? I think you could also explain how one gets it, and how much does it cost? Do you need a prescription or a permission from your doctor to get one? What's involved in getting a CAC scan?
Yeah, so the CAC scan is fairly easy to get here in the United States. Might be more challenging in other countries. Generally inexpensive. I would say the average price I see is around $100. I've seen it as cheap as $50. Maybe on the high end, it might go up to $250, and that's going to depend on your location. But usually you can shop around for it. You do need a doctor's orders. Now, some imaging centers will have a doctor there that will provide the order for you if you call up and you say, I want a coronary calcium scan. Other times you might need, your doctor to order a CAC scan. And like I said, it is a low radiation test. The amount of radiation is generally on par with getting a chest x-ray done. And there really shouldn't be many barriers to getting this test done. It needs to be used a lot more than it is. I draw the analogy that it's like a mammogram for the heart, right? The mammogram is the commonly used test we use to screen for the development of breast cancer, looking for signs of breast cancer before it gets to an advanced stage of disease. And the calcium scan can do the same thing for your heart. We can see this calcium, the calcified plaque, forming in your blood vessels. And if we see that early enough, we can then take the steps that are necessary to get it to slow down or stop progressing or even reverse, like we're talking about today.
What would happen if someone came back with a calcium score of 0? What does that mean? Say that the person was 61 years old, like I am. What would that mean if they got a 0 calcium score?
Yeah, so it means that they have no calcified plaque in their blood vessels, and that means that you have a very low risk of having a heart attack over the next 5 to 10 years. Now, the older you are when you have a 0 score, the more significant it is. If you're young, let's say in your 20s, 30s, or even 40s, it may not be as significant, but it's still important. And, again, I commonly see people now in their 40s ending up on my operating table. And that tells me that they probably had plaque starting to form in their arteries when they were in their 20s and 30s. So I don't think it's unreasonable to get screened at a young age, and just understand that if you have a 0 score when you're, in your 20s or 30s, that's great. You can't assume that you are cleared for life, right? It's something that you want to repeat, on a periodic basis, and make sure that your score is staying 0.
And what about people that have a higher score? Is that a disaster, or is there something that you can do about a really high score?
Yeah, so this is going to depend on how high the score is. And to give you an idea, the scores can range into the multiple thousands. I've seen scores 7, 8, even 9,000 is the highest the score goes. Now, generally under about 200, we don't worry too much about it. We don't worry about it in the sense of you might have a problem that we need to deal with immediately, but it's a warning sign that you want to stop that from getting worse. And then, once we get to scores in the range of, 200 and above, now there may be a chance that you might have some significant disease, and we might need to investigate this further. And again, this is, gets into a lot of different factors that are going to, determine that: your age, if you're having any sort of symptoms, how active you are. And this is when you really want to have a conversation with a doctor who understands what they're looking at on these scans. The CAC scan cannot tell you that you need a stent or that you're going to have a heart attack. It doesn't tell us how blocked up your blood vessels might be. I've seen people with lowish scores, 2, 3, 400, that end up, with a significant blockage and need a stent placed. But I've also seen patients with scores in the multiple thousands. One of my patients in the practice has a score of 5,000, and yet he does not have any blockages that warrant us putting a stent in. And so, there's a lot of sort of gray zone, and the CAC is just the screening test, but it's an important test to start with.
Let's see. We have a few comments, and I want to encourage anybody that's listening in on YouTube, on LinkedIn, Facebook, or right here on X. You can ask questions. So we're going to be going for another 15 minutes or so. So Steve Malloy just wrote, "Thank you for this info, Doc." Thanks for listening, Steve. Um, on YouTube, Rapture is soon says he's got an actual, he shared some of his information that he got a CAC and scored 543. And I think some of the information that Dr. Ovadia is going to be talking about over the next 10 or so minutes is going to probably be very important to you. Things that help reduce risk and increase the chance that you can manage your risk as you go. Let's see. I think you already sort of were getting to the. We have interesting comments about the medical system, but it can be frustrating at times. And Michael Pregler is watching, and he's got a CAC of 194. Anyway, all this information is interesting and should be helpful. And if anybody wants to contact us at Ovadia Heart Health and talk to our metabolic health coordinator, you can do that anytime. Just go to ifixhearts.com/talk, and you can set up a free appointment to learn all your options. So So the headline of this live stream is how to reverse heart plaque. Um, how important is it to actually attempt to reverse your heart plaque, or is it equally as good to bring things under control, to manage your score, your plaque CAC score, and give people a little context of what their real goals should be if they have high numbers right now?
Yeah. So I always tell people the first priority is let's stop it from getting worse. No matter kind of where you're, starting from. Even if you've had a stent placed already, for instance, and you've had a heart attack, like one of the commenters, right? We got to stop it from getting worse first, and then we can see if maybe we can get it to get better, right? But like a lot of things in life, you got to stop the damage before you can start to repair the damage. And so, this goes back to what we mentioned earlier. The primary drivers of atherosclerotic plaque are insulin resistance and inflammation. And so you need to assess those. Are those issues for you? And if they are, you need to reverse them. And again, working with a doctor who understands this is very important. But some things that you can start to do on your own, right? If you want to figure out if you're insulin resistant, what's your hemoglobin A1C? What's your insulin level? What's your ratio between your triglycerides and your HDL? And we have a lot of great information on our website about all of those. We're not going to go into the details today, but figure out if you're insulin resistant, figure out if you have inflammation. And the first priority becomes let's reverse those things. And the best way to do that is with diet and lifestyle, like we talk about all the time here.
Let's see. I know in the article you talked about different lifestyle things. What do you think is like the lowest hanging fruit for most people, that some of the things that can make the biggest differences in terms of reversing insulin resistance, making one more insulin sensitive, and reducing inflammation that's causing all sorts of problems for the progression of the disease?
Yeah. So if you are insulin resistant, the low hanging fruit is to get rid of the fruit and really all the carbohydrates, right? Anything that's, a carbohydrate is going to be converted to sugar in our body. And when you're insulin resistant, your body can't handle that. That's not saying that fruit is what made you insulin resistant. And that's not saying that fruit can't be part of a healthy diet for people that are not insulin resistant. But once you are insulin resistant, you need to eliminate carbohydrates until you're no longer insulin resistant. And that's the good news. Insulin resistance can be reversed. And that's what can then start the process, the healing process within the arteries that may allow us to start to reverse your plaque.
So where does something like resistance training and overall activity fit into the equation?
Yeah, so activity and resistance training to build muscle are great adjunctive tools to help you improve your metabolic health and reverse insulin resistance. The more active you are, some of that excess sugar that might be in your bloodstream is going to start to be utilized, right, for energy instead of accumulated in fat and causing damage to your blood vessels. Muscle is also very metabolically active tissue. It's going to help consume some of the excess glucose. And it's also a place that we can start to store some extra sugar in the form of glycogen. So building muscle, getting more activity, reducing your carbohydrate intake, reducing your processed food in general. These are all the pillars that we talk about. Getting good sleep and managing your stress are the other two. And again, we talk a lot about this in my practice. This is what we focus our work with patients on. And there's a lot of great information about this in the book and on our website as well.
Can you give a little context about like what someone could expect with respect to improving their metrics? through lifestyle changes, because I've seen a lot of mainstream practitioners pretty much discount the possibility that one can make that it's reasonable to expect sustainable, meaningful changes to body composition, to body fat, to muscle mass through the changes that personally I see every week go on in the practice as a health coach. I've been working as a health coach since last January, and it's remarkable. And I've seen um, some incredible cases where people have, reversed their A1C from in the 11s down to below 5.5, where they're full-fledged type 2 diabetes patient, and they go to not having type 2 diabetes at all. What are your thoughts about why mainstream medicine discounts this as a realistic possibility for people? And tell people a little bit about what goes on at Ovadia Heart Health that is different.
Yeah, the unfortunate reality is doctors don't know that this can be done because they don't see it happen in their patients. But we see it happen in our patients all the time. You and I have both seen it happen in ourselves, and maybe that was the first step. But just putting people on medications, which is the approach that the healthcare system largely focuses on, isn't going to accomplish that. And if you don't know to go beyond that as a practitioner, and the sad reality is that most practitioners don't get exposed to these methods, right? And they can't work with their patients to do these types of things. And I had to sort of go outside of the mainstream and the information that was being put in front of me, and tackle the problem for myself. And that has now allowed me to learn how to help other people to do that. And like you said, this is something that we see every day in our practice. And we see people that are reversing type 2 diabetes, reversing their insulin resistance, and lowering their inflammation.
Oh, great information. We have a couple more comments. We have a lot of people that are listening in today. Um, Thank you, Anthony Scavo, for your comment and for joining us. You're over there on Facebook. Um, I think we already put that one up. And let's see. Here's a question from Pete. I don't know if you can give Pete any sort of information, but what do you have to say to Pete?
Yeah, so non-calcified plaque does matter. And how much it relates to the calcified plaque is a great question, right? And that's where the more advanced imaging tests like the CT angiogram can come into play, because that will show us both the non-calcified and the calcified plaque. Again, from a screening standpoint, just looking for the calcified plaque is adequate. And if you don't have significant amounts of calcified plaque, it's pretty unlikely that you're going to have real significant amounts of non-calcified plaque. But this is where the advanced studies with the CT angiogram are starting to show us. And this can vary a fair amount. Some people end up with a lot of their plaque being calcified. Other patients end up with a lot of their plaque being non-calcified. There are a lot of factors that go into that, but ultimately, the calcified plaque is a great place to start.
Great. Let's see. We got another person on X. Red Pill reposted this live stream. Thank you. One of our own health coaches and director of employee wellness, Krishna Hanks, is listening along and retweeted. Thanks, Krishna, for listening, and thanks for retweeting. I want to share a link. If anybody wants to, you can find the article. It's a long link. What it takes to reverse heart plaque. But if you just go to the blog on ifixhearts.com and you put in the word plaque, it'll come up right on the first page. Great article. And if anybody that's listening today wants to get a free preview of the first 40 pages of Dr. Ovadia's book, Stay Off My Operating Table, just go to ifixhearts.com/books, and you can get that first 40 pages. And if you like it as much as I think you will, you'll have a link to buy the book right below that on the same page. And I wanted to ask you a couple of questions, Dr. Ovadia, about the decision that patients have to make. You know, they're told by their doctors that you need to get on this statin, or sometimes it's another drug. Talk a little bit about the process that goes on between you and the patient. And I know sometimes the patients are working with multiple doctors. They're getting a second opinion, or sometimes they're getting a third opinion. And they want to be confident that they're making a sound decision with respect to these medications. You know, when does Ovadia Heart Health prescribe medications, and what's the process for figuring out what's right for an individual patient who has a lot of stress and pressure and trying to make what is truly the best decision for their health?
Yeah, I believe that these decisions shouldn't be, stressful, and you shouldn't be felt like you're being forced into them, right? You should be able to ask your doctor questions, and your doctor, if they believe that, a certain treatment is the right one for you, they should be able to make you comfortable with that decision. They should be able to explain what are the risks of the treatment, what are the benefits of the treatment, what are the risks of not doing the treatment, and maybe what might the benefits be of not doing the treatment. You want to understand all sides of those arguments, but importantly, your doctor should have the time to discuss that with you and should be comfortable discussing that with you. And unfortunately, what I see all too much in the mainstream medical system is doctors don't have the time, and they sort of get annoyed when patients question them, and they believe that patients should just follow their advice blindly. And again, that's not how we practice medicine here. That's not how I practice medicine personally. And so, if we are considering medications or changes to your diet and lifestyle, which are certainly a treatment, those should be discussed in the same way. And you, as the patient, then should make the ultimate decision about what best aligns with your goals. And you should be comfortable, right, that this decision that you're making is the right one for you. So if you're feeling pressured by your doctor, if your doctor isn't taking the time to explain things to you, then it might be time to find a new doctor.
And what do you have to say to somebody who's been putting off the entire thing? You know, they know they have heart history in their family. They know that they might have been experiencing symptoms, but they rather just they kind of accept that they just have drawn a bad lot, and that there's nothing they can do, and they're just like living in fear almost that something's going to happen. um, what do you say to give people hope that there's things that they can actually do that are going to make a difference over the next 10, 20, 30 years or more of their life, and also the chances of improving the quality of life along with the decisions that they make?
Yeah, so there is nothing about this that dooms anyone or predetermines anyone. Genetics are part of this, but they're only a small part of it. And sorry about the dog, and I appreciate Michael's comments about it. The genetics are a small part of what happens regarding your heart disease outcomes. Diet and lifestyle are the most powerful factors. So you might be more prone because of certain genetics, but that doesn't mean that if you do the right things, from a diet and lifestyles perspective, that you can't still, you'll still be able to prevent yourself from heart disease becoming a significant issue for you. And I also always tell people it's never too late to start this, right? Even if you've had stents, even if you've been on my operating table or some other heart surgeon's operating table, you can still make these changes and you can start to see the benefits of those changes. And like I talked about at the beginning, our real goal is to stop things from getting worse. And if you do that, you're going to feel better. And now we have the possibility of things starting to reverse and improve.
That's a great answer, and I know we're getting really close to the end. There's two messages that have just come through, and maybe I'll put them both up and just see if you can kind of put a one last like answer that might guide Kai and friends who's listening and watching on YouTube. Is 10-year ketogenic diet person with a CAC score of 14 to 87 a walking dead man? Is that hopeless? And then there's D Love of God, who's also on YouTube, 73, and has been on statins for 23 years. Doctor wants me to stay on. So we got two people with really specific things, but maybe a general answer that could explain number one, the question about hopelessness, and two, the idea that a patient can make their own decisions with intelligent information from a medical practitioner like yourself along the way.
Yeah, so like I was alluding to earlier, it's never hopeless. We've had patients, first of all, with high scores much higher than that. We've had patients that come to us after already having advanced disease, having heart failure, and we are able to get significant improvements for them. And again, for the other questioner, if your doctor isn't listening to you and, they're kind of forcing you into things that you're not comfortable with, and they can't explain to you why, it might be time to find another doctor. And we encourage people to reach out to us, ifixhearts.com/talk. We see patients via telemedicine across the United States and even internationally that we are able to work with people. So if your doctor isn't working for you, we invite you to check us out.
Okay, and before we the last thing before we sign off, if anybody wants to get the 40-page preview of Dr. Ovadia's book, Stay Off My Operating Table, go to ifixhearts.com/books. It's a great read. I've got a copy behind me. I see you got a copy behind you, Dr. Ovadia, and I refer to mine often. It's great to read cover to cover, but it's also a great reference book for all aspects of lifestyle and beyond with respect to staying off Dr. Ovadia's operating table. Thank you very much, Dr. Ovadia, for taking the time out of your busy schedule and joining me on this live stream. We do these generally twice a week, and we cover telemedicine aspects, and we also cover employee wellness aspects. Thank you, everybody, for joining us, and we look forward to seeing you next time.